Okay, good morning, everyone. I'm Jeri Shikuma, ACC's Home and Community-Based Programs Administrator, and it's such a pleasure to welcome all of you to ACC Senior Services. I'd like to thank Congresswoman Matsui and her staff for organizing the event today and for choosing ACC to share her message about the important new drug legislation that passed in the Inflation Reduction Act. Congresswoman Matsui has been a steady friend of ACC over the years, supporting our efforts to improve the health and well-being of older adults and their families in the Sacramento region. During her 17 years in Congress, she has been committed to advancing many of the issues that are so important to the seniors in our community. Congresswoman Matsui has been a leader on a wide range of health issues that impact seniors in our community. Everything from increasing community-based access to mental health services, to expanding the use of telehealth, which has been so important during the pandemic, to protecting and strengthening Medicare and Older Americans Act. And the reason we're all here today, to ensuring that quality health care is more accessible to all. Today, we're excited to learn about the Congresswoman's latest work in making prescription drugs more affordable and accessible for seniors, people with disabilities, and people with chronic illness. Congresswoman Matsui, it's an honor to have you here today. Welcome back home to Sacramento, and welcome back to ACC.
Thank you. Thank you so much, Jeri. It's really great to be here. I gotta say that this is really wonderful. I remember when this first started. So when you're describing the services as described here, it's really truly remarkable because I think it was, well, I hate to say how many years ago, when my late husband, Bob Matsui, with his grandmother realized how the dearth of services for particularly seniors of Asian American extraction. And from there developed a small group of people who realize how important it is to take care of the senior population. And that has evolved and developed into this, where this senior focus center and families have taken over in a sense of moving beyond just a small population. It serves a lot of different people, different communities throughout Sacramento. And it really fills me with somewhat awe and gratitude for everything that all the volunteers and all the advocates have done to ensure that they make sure that their parents and grandparents have the care that they need to live the type of life that they deserve. So to me, this is really a pleasure to come back. This is wonderful. I am here because I want to talk to you about a historic step forward in healthcare. 3 years ago, I held a press conference highlighting the struggle for high prescription drugs costs in this community and across the country. And during that time, I shared a story about a constituent, Cynthia. She was, at that time, 71 years old, who'd been suffering from seizures because of a brain tumor. And her out-of-pocket costs essentially cost her over $3,400, per year. And she was on a fixed income. And that is absolutely, unbelievably tragic in a sense that she had to choose so much about what she can pay for and really depend upon the help of others. That, unfortunately, is a story of many of Sacramentans with a skyrocketing prescription drug costs. And so we have been trying to work at it for many, many years. And I've had conversations with many of you. And I take those stories, your efforts, and translate them into congressional action with my colleagues. People like Cynthia and all of you inspire me to ensure that we continue to fight to lower health care costs for all Americans, to really ensure that there is better health care for everyone, and especially our seniors, our Medicare beneficiaries. So fast forward today, almost 3 years later, I'm really pleased to say that we have delivered. We have heard. We know what it takes. We know what everyone here needs to do in order to ensure that they stay healthy and their parents and grandparents stay healthy. In August, the House passed the Inflation Reduction Act, and we refer to it as the IRA, which will make prescription drugs more affordable for seniors. The Inflation Reduction Act also extends ACA marketplace premium tax credits, which will help millions of older Americans nationwide save on their monthly health care costs. But what specifically does it mean for all of us? And the 100,000 seniors in my district, including Cynthia, with Medicare coverage. This landmark new law will deliver historic reforms, including ending the anti-competitive ban on Medicare negotiating directly with drug makers. This means that lower prices on the most expensive brand name and biologic drugs that have no competition. Number 2, creating a $2,000 cap on out-of-pocket costs for Medicare beneficiaries. There are no such caps in Medicare Part D today, and I've been fighting for this policy for years because we hear about it all the time. So many people go beyond, and we have to cap it, and we have done this now. It'll make a huge difference for seniors, especially with those with certain conditions of high-cost treatment like cancer and MS. Now, limiting monthly cost sharing for insulin products to no more than $35 for Medicare beneficiaries, beginning soon, like next year. And requiring drug companies to pay Medicare rebates if they raise prices faster than the rate of inflation, starting now. This means no more price gouging the American people without facing accountability. Reform is here now. And we thank all of you for being involved in this process, because we understand that Medicare, Social Security, and Medicaid isn't just for seniors. It's for all families. It impacts everyone. And I think from day one, with the younger population, we start talking about the importance of Medicare, Social Security, and Medicaid. Because at some point in time, as we move along, we get older, we're going to be using these things. And just remember something that people don't really think about too much, but it's true. Medicare and Social Security are like insurance policies. Don't ever have people say they're welfare, because they're not. We pay into this system. It's for all of us. It's for all of us. Now, we have greater opportunities now moving forward to lower the cost of health care for all Americans. This legislation is really about people over politics. Let's remember that. Because people are who we're talking about. All of you, all the people in our families, all the people in our communities. And we are taking monumental steps to improve the lives of everyone across this country, particularly seniors. And this is just the start. I'm excited to see the Part B premiums and deductibles going down next year. I think all of you who understand that know how critical that is. This is welcome news for seniors who are struggling with the rising costs due to inflation. And you all heard the news last week. The Social Security Administration announced an 8.7% increase in the cost of living adjustment for 2023. This is historic. This is the first time in 40 years. So we know how important this is, and it comes at such a critical time. This bump in Social Security, combined with lower Medicare prescription drug costs and more affordable health care premiums, all deliver much needed financial relief for older Americans. Congress must keep this momentum going, and we are. I have my staffer here from Washington, D.C., Christine, and my staffer here, Nia, who we've worked with, I know, closely. They are closely involved in this, and they are here to listen to you, as they do every single day. I want to thank the various advocacy groups in Sacramento, West Sacramento, who've lent your support, your voices, your advocacy for these changes that has really ensured that we can move forward here. So I just want all of you to remain loud, but courteous, so we can understand that there are other things we have to do. Now, I want to bring Jeri back to the platform here to talk more about how this impacts the seniors here at ACC. Jeri?
Thank you, Congresswoman Matsui. I appreciate you coming out and sharing the news of this new legislation, which, by the way, I just had a recent conversation with some staff at HICAP, and they said that they already see that this legislation is helping seniors in our community. So I think that's exciting. 50 years ago, ACC Senior Services was founded, like Congresswoman Matsui mentioned. It was founded by community activists who wanted to make health care and social services more accessible to the most vulnerable in our community. Today, we serve many who have fixed, moderate to low incomes and who have chronic illnesses, some of them multiple chronic illnesses and disabilities that require ongoing use of medication for many, many years. For them, the high cost of prescription drugs sometimes means having to make tough choices in their daily lives. Do I buy medicine or food? Do I continue my prescriptions, or do I have enough money for rent and transportation this month? Capping the out-of-pocket costs of medications and lowering drug prices are important steps in making sure that seniors and their families don't have to make these tough choices. However, there is still much more that needs to be done to truly make healthcare more affordable and accessible to the most vulnerable. Every day in ACC's home and community-based programs, we work with seniors and their caregivers who face barriers to resources they need to live healthy lives. Just in the last few days, I've met with seniors in our programs who have shared some of their struggles with me. I've met with a senior who had to pause taking their medications because of a lapse in insurance, another senior who is allergic to a generic drug but can't figure out how to get approval for the name brand one that her doctor prescribed. I met another senior who has insurance but has difficulty understanding all the paperwork and policies. I can relate to that one. And so even obtaining eyeglasses, a new pair of eyeglasses, has been so complex and so frustrating for her. And still another senior who says she and her husband have legally separated because as a couple, they weren't eligible for the help they needed to afford the health care and the medicine that he needs. Like I said, there's still a lot of work to be done. So today, I'd like to join all of you in celebrating this milestone accomplishment, but I also want to encourage Congresswoman Matsui and all of us to continue to keep working on these issues so that more seniors and their families can access the health care and the resources that they need to really live healthy, active, and independent lives. Thank you. And now, I would like to turn it over to another prominent leader in our community who probably really doesn't need an introduction. He has also been a longtime friend of ACC and has been for many years a member of the Sacramento County Board of Supervisors. Please help me welcome Supervisor Patrick Kennedy.
Thank you, Jeri. It's always great to be at ACC, and I look forward to celebrating a milestone tomorrow night. I'm so happy to be here today, and I'm always happy to share a stage and privileged to share a stage with Congresswoman Matsui. We could not have a better fighter for us in Washington, D.C. for the Sacramento community, and specifically for the senior community. So thank you very much, Congresswoman Matsui, for everything that you continue to do. As was mentioned earlier, healthcare is a right. People should not have to choose between healthcare, medication, rent, groceries. Healthcare is a right. And this legislation makes that true for so many seniors who had to make those choices when they shouldn't have. I know that when I was walking door to door recently before the June election, I knock on doors and I'd ask people, what's on your mind? What's important to you? And I came to a door, and just like Cynthia, this woman came to me, and I saw her. And as we started talking, I watched tears well up in her eyes. I watched fear come over her face, because she had to make those decisions. She had to make those choices. And she was very fearful that she would lose that lifeline that she needs. She should not have to forego her medication or health care that she needs, vital health care that she needs, because of skyrocketing costs. And because of the work of people like Congresswoman Matsui, she no longer will have to. So I want to thank you for having me here today, letting me celebrate this great moment for our country, this great moment for Sacramento, and again, thank Congresswoman Matsui. So with that, I would also like to bring to the podium my friend and colleague on the Board of Supervisors, Phil Serna.
Well, good morning to you all. It is indeed an honor, as my colleague Supervisor Kennedy just mentioned, to share a podium with the Congresswoman every time she's back here in Sacramento. This day is certainly no different, but it is a special day, and you're continuing to hear a theme here in terms of celebration for a righteous milestone, in terms of the legislation that, with her hard work, was thankfully passed in Congress, so that seniors can have the ability not to make those tough choices between food, transportation, and their prescription drugs. But I wanted to kind of put a personal flavor to this for me. I think many of you are aware that my late parents, both suffered struggles with cancer before they passed. And as anyone knows, living with or taking care of family members that have a chronic condition, I can distinctly remember when I was taking care of both my mother and father, as they're both battling cancer at the same time, filling their pill boxes. And if you consider someone that is in a struggle for their lives, and the fact that they rely on prescription medication the way they do, and then to have to think that here in the United States, these choices are having to be made about life-preserving treatments and drug therapies and other aspects of survival, really makes you reflect on the fact that we have so much left to do. And I've had the privilege and honor to join Congresswoman Matsui many times in Sacramento to celebrate things like flood protection, which she's been the champion of, hands down, in terms of protecting folks here, especially in the Thomas. But it is days like this when we're talking about human beings and how best to keep them healthy and extend their lives that really means everything to us in the world of county government, especially where it is our local charge to look after and take care of our elderly population. So again, I just want to extend my sincerest gratitude to the Congresswoman, and she can certainly continue to count on Supervisor Kennedy and I to flank her and everyone else that's involved in making sure we're taking care of our most vulnerable here in Sacramento. Thank you. And with that, as I just mentioned in terms of county responsibilities, one of our county arms, the Area 4 Agency on Aging, is represented here by Will Tift this morning. So I'd like to bring Will to the podium.
Thank you. Good morning, everyone. So while the Congresswoman has been doing all this good work for Sacramento, she's also been doing it for the country. As a leader in the House of Representatives, when she approves appropriations for the Older Americans Act, that goes nationally to agencies on aging in every state. When she approves funding for SHIP, the state health insurance program known in California as HICAP, that goes to all the states. So we're talking about benefits For Medicare beneficiaries here in Sacramento County, about 266,000 Medicare beneficiaries right now. In the Sacramento region, more like 600,000 Medicare beneficiaries, but nationally. So Jeri mentioned HICAP. HICAP was created in the 1980s here in the Sacramento region, Health Insurance Counseling and Advocacy Program. One of the great programs that became national, it was so good, and is funded through the state as well. And the phone number for HICAP is 1-800, I might need my glasses, 434-0222. And these are volunteers, usually folks who have retired from working in the healthcare industry or the insurance industry, and can set appointments and work one-on-one with folks to help them figure out which plan each year is best for me through the open enrollment period, which is happening now. So that's an important resource. You know, I think what we see here in the Inflation Reduction Act is, for the first time in my career, which is, I'm still a young guy, but I've been doing this for 20 years, sweeping reform to Medicare, and it helps Medicare, which helps us all, and it does it without increasing payroll deductions for current employees, and it does it without reducing benefits for current beneficiaries. So that's profound, and we're going to see that impact multiply over the next several years as all the elements of this roll out. So great work, and back to you, Congresswoman.
Thank you, Will, and thank you, Jeri. Thank all of you for being here today. I want you to know how important that all of us feel about this, because there's a passion around making sure that we keep people healthy so they can live the lives that they deserve to live. And I really feel in this particular matter, we took an opportunity here to do something regarding prescription drugs that we've been wanting to do for a very long time. We also know that in this time, healthcare costs have always been increasing. We're bringing them down, in particular for the most vulnerable among us. And so I want to thank all of you, because we can't do this without an army of people helping us at the local level and the state level and all across the country. Because the policies that start at the top just aren't dreamed up. They come from the people around us in the communities, our constituents. And we look at that and think, okay, we need to do this. We hear you. And we've been hearing you for a long time. So now we finally said, this is the way we can do it. So as we move forward, the benefits of what we've been talking about today will only grow as these programs get more and more established and they become something that every single one of us can rely upon that will sustain us in the future. So thank you very much for being here. And I want to say that let's try to keep working together on all of this. Thank you so much.